Angus Deaton, The Great Escape, Health, Wealth, and the Origins of Inequality. In his insightful book, The Great Escape, Health, Wealth, and the Origins of Inequality, Angus Deaton addresses the significant rise in overall well-being and the extreme inequality that still exists in today's world. The summary elaborates on the reasons for increased well-being, such as access to health services, better economic prospects, and improved quality of life, but also emphasizes the marked disparities between rich and poor countries. Further, it explores the ways in which inequality can lead to progress, provided that it's approached in the right manner. The book traces the development of human societies from simple hunter-gatherers to complex modern civilizations, touching on various advancements that have shaped where we are today.
The bright side of life. Despite global inequality, overall well-being has improved considerably, with increased life expectancy and education opportunities in developed countries. News outlets often focus on negative events, providing a distorted view of the world's progress. The reality is that, on average, well-being has improved significantly in the last 250 years. Most people used to live in poverty, but today, only 1 billion face extreme poverty and suffer terrible living conditions. In contrast, people now have access to better healthcare, higher pay, longer lifespans, happiness, education, and general quality of life. For instance, a white middle-class girl born in the United States today has a life expectancy of over 80 years, with a 50% chance of living to 100. She also benefits from increased educational and economic opportunities compared to her parents. Nevertheless, massive inequalities continue to exist between rich and poor countries. For example, health standards in Sierra Leone are worse than they were in the United States in 1910, when a quarter of children died before age 5, and over half of the population in the Democratic Republic of Congo live on less than $1 per day. But these inequalities can lead to progress if used well. Poor countries can adopt innovations that improve life expectancy and diminish the gap between rich and poor countries. Although there is still much work left to be done, it's vital to acknowledge the significant improvements in our well-being so that we can continue to work towards a fairer world. The paradox of the agricultural revolution. The agricultural revolution led to a decrease in well-being and a massive increase in mortality from diseases, despite a decrease in competition for food. Since the advent of agriculture, humans have experienced a paradoxical decline in their well-being. The hunter-gatherer communities lived healthy lives despite their short lifespan of 40 years, spending their days looking for food and shelter. These tribes enjoyed a very balanced diet, shared what they found with one another, and were able to move on before disease spread. In contrast, the agricultural revolution led to a decrease in well-being and a massive increase in mortality from diseases. Although the settled life meant less dependence on the seasons and climate, less travel, and less competition with other tribes for food, early villages and cities were dirty. These early villages and cities placed the food next to the feces of domesticated animals, and the disease spread quickly through trade. As a result, people lived shorter lives and often died young due to diseases or catastrophic famines after droughts. It seems that settling down was not the answer to a better way of life, as hunter-gatherer communities had already found an effective and healthy way of living. Improving global life expectancy. Global life expectancy has increased due to advances in healthcare, disease prevention, nutrition, and education. Child mortality rates have decreased significantly, with many countries now only at a 0.5% rate. Scientific developments like the germ theory and improved sanitation have also played a role in improving health and mortality rates worldwide. While there have been setbacks such as the Great Famine in China and HIV/AIDS outbreaks, the overall trend has been positive. However, preventable diseases like cholera, measles, and diarrhea still affect children in some areas. Overall, global improvements in health have allowed for longer life expectancies, with many now able to see their grandchildren and even great-grandchildren. Healthcare inequality. The lack of motivation from governments and inadequate knowledge in poor countries regarding preventive health measures has caused countless deaths from easily treatable illnesses. The most vulnerable, including children, suffer from malnutrition and infections because advanced medicine is accessible only to those who can afford it. Moreover, undemocratic governments prioritize other issues, perpetuating healthcare inequality. Citizens are unaware of their rights to adequate health care and do not demand change. Challenges of extending human life. Despite technological advancements, extending the lives of the elderly beyond 50 years is still a challenge. Chronic diseases like cancer, cardiovascular disease, and pneumonia remain leading causes of death. Billions of dollars are invested in research on these diseases, but increasing healthcare spending is not necessarily the solution. Rather, lifestyle changes, better education, and improvements in living standards are vital in preventing illness. People today smoke less, live healthier lifestyles, and know that they can live long lives. It is time for society to prioritize these changes, not solely rely on healthcare initiatives to solve the problem. Bridging the global inequality gap. Inequality exists not only within nations but between them. The Industrial Revolution and Enlightenment reduced the wealth gap between poor and rich within nations but created global disparities. Today, the richest 1% in the United States controls the vast majority of wealth while poverty restricts social and political participation and hinders access to education. In contrast, the top 0.01% of income earners benefit from lenient tax laws and regulations. Poverty and inequality still persist in many parts of the world, with the number of people living in poverty doubling in Africa between 1981 and 2008. It is imperative that we address global inequality and work towards a more just future for every individual, regardless of their socioeconomic status or where they live. Globalization and poverty. Globalization has brought about numerous benefits, including the ability to purchase goods from anywhere in the world at affordable prices. It has also facilitated the rapid spread of information and innovation through developments in global telecommunications infrastructure. However, while access to knowledge is crucial for progress, it is not the sole requirement for escaping poverty. Lack of essential institutions hinders growth and progress in many countries, leaving them behind in terms of economic advancement. Some countries, such as Hong Kong, Japan, Singapore, China, and India, have made remarkable progress while others, like Liberia and Afghanistan, have fallen behind. Although a few poor countries have progressed into middle-income ones, others have become even poorer than they were in the past. The Democratic Republic of Congo is one of these countries, where political and economic instability has led to a decline in living standards. In conclusion, globalization can contribute to poverty reduction, but without proper institutions in place, progress will be limited. Effective poverty reduction. Poverty cannot be eradicated by aid alone. The effectiveness of development aid is questionable due to bad governance, corrupt regimes, and malfunctioning institutions. Trade restrictions and dissemination of scientific knowledge and democratic processes are more effective ways to fight poverty. Additionally, private remittances and capital funding from investors can be vital. The international community should help level the trade playing field, and migrants should be allowed to temporarily enter rich countries in pursuit of higher education. Simply throwing money at the problem is not the solution.
Angus Deaton takes the readers through an eye-opening journey, revealing how humanity has come a long way in terms of well-being, health, and wealth. While we have made immense strides, evident inequality still plagues the world. There continues to be a lack of motivation from governments, education, and essential institutions in underprivileged countries to improve well-being. Moreover, globalization and simple cash aid don't guarantee progress or resolve poverty. It's crucial for us to thoroughly explore and understand the root causes of inequality and find effective ways to eliminate these gaps, like building better institutions, disseminating knowledge, and providing equitable access to opportunities. Readers walk away with a broader understanding of the evolution and progress of humankind so far, while also being motivated to work towards a more just world.